I'm very glad to be asked to speak here today. And our starting point is about relationship, and it's about the relationship of the child and the mother. And I'll be talking about how crucial it is to recognize and support that mother-child bond and mother's caring work as central to child welfare. So hopefully it'll be a start of a slightly different conversation than we've been discussing so far, perhaps. So by way of background, Support Not Separation is coordinated by Legal Action for Women. It includes organisations of single mothers, women of colour and asylum seekers and refugee women, women with disabilities, rape survivors, breastfeeding advocates, kinship carers, psychotherapists, men and social workers who are committed to defending mothers and children against unwarranted separation and the devaluing of the mother-child relationship. We work closely with Give Us Back Our Children in the US, which is part of Support Not Separation, and with mothers in other countries who share our aims. In 2017, we published a dossier, Suffer the Little Children and Their Mothers, and in the same year, we started having monthly pickets outside the family court in central London and a Twitter storm at the same time. We're coming up to our 8-year anniversary on the 5th of March, and our picket this month celebrated the victory that courts in England and Wales are now open to journalists and legal bloggers, ending the secrecy of the family courts. And that's been one of our central demands, and it's a massive victory. We also hold monthly collective self-help meetings at the Crossroads Women's Centre, where we're based, and also online, where mothers exchange experiences and draw on the experiences of the organisations based at the centre, especially Women Against Rape, Windvisible, and Women of Colour in the Global Women's Strike. We've a blog and an online self-help guide, which we always refer women to. When we put together a snapshot of 250 mothers with 446 children we worked with, this is what we found, and it really exposes what's going on in the family court, which is crucial to understanding why so many children are in the care system. So 94% were single mothers, mostly on low income, all on low incomes. 83% had suffered domestic violence, 42% had mental health issues, 40% were women of colour and/or immigrant women, and 17% had a physical disability which had been used against them. They were nearly all fighting over contact with their children. They were trying to stop violent fathers having safe, unsafe, unsupervised contact, or were trying to re-establish contact with children who had been given to the father, or who were in foster care, or who had been adopted as a result of hostile social workers and judges. Over half the mothers had had their children removed, including 10% whose children had been adopted without their consent. And this shocking figure gives lie to the idea that forced adoptions are historic. They are, in fact, a present-day policy of punishment and social engineering, affecting thousands of children and their mothers every year. So from our experience and the experience of the mothers we work with, it's clear that the discussion about how to improve children's social care has to start with how to significantly reduce the numbers of children in care in the first place, so they are spared the lifelong trauma of being separated from their mothers and families. It's totally wrong to start with recruiting more foster carers or more social workers. This encourages the removal of more children. The corporate parent is not benign. It cannot substitute for a natural loving mother, and it must be dismantled, not expanded. Reforming children's social care has to begin by recognizing the importance of mothers in children's lives. After all, we carry them for 9 months, give birth, and in the majority of cases, are their primary carers for the whole of their childhood. Yet social workers, psychologists, and other professionals increasingly disregard this reality in favor of fathers, and the mother-child bond and the importance of mothers in children's lives are dismissed, ignored, or devalued by the corporate parent. And the courts never take into account that children are often more traumatized by being taken from a mother who maybe struggles with mental health or a physical disability or with a drug or alcohol problem than by being forced to live with strangers rather than if they had stayed with their mother or were supported to live with grandparents or other family members. And kinship carers are also greatly undervalued, as mothers are, and we recognise the crucial work being done by the Scottish Kinship Care Alliance, who are on this call, who are mostly grandmothers raising their grandchildren. They've fought long and hard for kinship carers to get the same financial and other support that foster carers get, and in some parts of Scotland they've succeeded. But even when they succeed, the system discriminates against those who are on benefits, who get some of the money for kinship care deducted from their benefits. They've also fought for recognition of, quote, voluntary kinship carers who take on their grandchildren without them ever having to go into the family court system, but then they don't get any financial support at all. This is an abuse by the state, which only gives financial support after causing trauma to the children by separating them and taking them into foster care, eventually giving them back to kinship carers. But by that time, they're traumatized by the early separation from their primary carers. Grandmothers or other family members who step in immediately get much less financial and other support than other kinship carers or foster carers, and that has to change. The fact is that there are over 630,000 children in care in England, with an estimated 107,000 children in care across the UK. This includes a disproportionate number of children of colour, including those taken because their immigrant parents have no recourse to public funds, and also disabled children. And recent research shows that as many as 1 in 4 children in England will interact with social care services before they turn 18. At the same time, 4.3 million children live in poverty, and that number is rising year on year, made worse by the 2-child benefit cap, the bedroom tax, and the overall benefit cap. Families cannot afford to meet their most basic needs of housing, heating, clothing, and increasing numbers, as we all know, are forced to use food banks. Yet child neglect, in inverted commas, i.e. poverty, is the single biggest target of the corporate parent, together with domestic violence, which is deeply connected to poverty, which stops women escaping. 10,000 children entered the care system for reasons linked to poverty in the 5-year period from 2015 to 2020. And we know too that disabled children are more likely to be looked after than non-disabled children, and are likely to stay in care longer, and are 5 times more likely to be abused in institutions. The Disabled Mothers' Rights Campaign, which is part of Support Not Separation, worked with Channel 5 on its national news programme in 2023, and their shocking findings were that parents with a learning disability are 54 times more likely to have their children taken into care. And at the heart of this is that disabled children and their mums are less likely to receive the correct support than their peers, simply because Section 17 support in the Children's Act is not mandatory. Disabled children often have disabled mothers, and due to discrimination, social workers often claim that the mothers are projecting, in inverted commas, their own disabilities onto their children. In other words, the children's needs are not genuine. This leads to child protection and/or child removal rather than assessing a child's needs. And if saving money were part of the calculation, taking children into care is much more expensive than early support. The disastrous outcomes for care leavers are widely known, yet rarely feature in discussions about what can be done. I did put it in the chat. They're over 10 times more likely than their peers not to be in education, employment, or training by the time they're 21. When they leave care, 50% will be in the criminal justice system by the age of 21, 25% will end up in prison, 50% have mental distress, 70% die prematurely, and are 20 times more likely to die by the age of 25. Now that surely shows what a terrible job the corporate parent does, and makes clear that the best way to improve the well-being of children in care is not to take them into care in the first place. Despite this appalling record, rather than prioritise support to families under Section 17 of the Children Act, that support has declined significantly. Parliament was told recently that every year local authority budgets allocated to Section 17, which is to support families, have been reduced by 50%, whilst budgets for Section 47, which is child protection and removal, have more than doubled every year. This means that very often when mothers go to children's services to ask for support they are entitled to, including because they're victims of domestic violence or need support for disabled children, they're told no help is available for cost reasons. Mothers are too often blamed for not coping with their disabled child's needs as a way of cutting money spent on supporting families and/or punishing them for having children in the first place. Instead, mothers are pushed into child protection, where they face intervention and investigation by social workers. It's urgent for Section 17 spending to be put on the same footing as Section 47 spending. That means it should be a statutory duty instead of optional, and spending on support must be prioritised over spending on child removal. That is the only way that support for mothers and children will be taken seriously. And we'd add that social work assessments under Section 17 must be done separately from assessments under Section 47, which at the moment they happen under the same single assessment. The fact is that the increasing privatisation of children's services has led to fostering and adoption becoming a highly profitable industry worth millions, which depends on a continual supply of children. A recent report showed that the largest 20 independent providers of children's social care brought in profits of more than £300 million in 2022. This is obscene profiteering from children and mothers' money and can't possibly be defended. And rather than capping profits, there should be no run-for-profit organisations, either in children's homes, residential schools or foster care. We know that's happening in Scotland, and we know that Wales are proposing something very similar. And the money saved should be allocated to Section 17 support and other measures such as increasing child benefit, which Scotland has already done, and providing a care income for mothers and other primary carers. The fact is that some local authorities do take this supportive approach with good results. In the 1970s, Andy Bilson reduced the numbers of children going into care by 70% as a result of giving social workers in Fife the same budget for supporting children at home as they got for taking children into care. And recently, Neath Port Talbot, which had one of the highest numbers of children going into care in Wales, started supporting families in the community, and as a result it has halved the number of children in care and now has one of the lowest rates in Wales, despite contacts to their team increasing by 53%. Helping children stay with their mothers is a priority in Neath Port Talbot and should provide a model of good practice for others to follow. The current Children's Wellbeing and Schools Bill going through Parliament assumes that children's wellbeing will be improved by more professionals in their lives, more monitoring by more agencies, and more foster carers. This is absolutely not true. And the introduction of a consistent identifier, which we thought was to refer to all children, it's worth noting that when something similar was introduced in Scotland, it was challenged at the Supreme Court, which said that it was illegal because it contravened the right to family life under Article 8 of the Human Rights Convention. So that should be a non-starter right there. The fact is that children do not belong to the state. They belong with their families, and the state has already proved to be the worst possible parent. We are making a submission to the committee submitting the bill, the committee considering the bill, which we'll put on our blog and will be available shortly. But we did want to comment briefly on the proposal to limit a parent's power to home educate their children. The fact is that studies show that the risk of abuse for homeschool children is half or less than at school. And most home-educated children are removed from school by their families because of the current broken special educational needs SEND system. And the bill does nothing to address any of the problems with SEND. And this proposal might have been fueled by publicity about the Sarah Sharif case, because, which people I'm sure know about, she was removed from school and home educated, but she was known to social services and the school's concerns were reported to them, but no investigation happened and the case was closed. The issue is not homeschooling, but the fact that children's services are very reluctant to challenge violent fathers, and that a family court judge sent her to live with her father despite knowing his long history of domestic and physical violence. And that is our experience of family courts, which are obsessed with removing children from mothers who report domestic violence, as Sarah Sharif's mother had done, and giving them to the father despite their history of domestic violence. Yet it is mothers who try to protect their children and fathers and stepfathers who are most likely to kill and rape them. Where mothers are involved, it's mostly because they themselves have been victims and have been denied support. Before I put forward our recommendations for change, I just want to point out publication this week of a book which is generating much debate and many positive reviews. It's called Wages for Housework by Emily Kalachi, and it's focused on the 50-plus year history of a movement which I and others in SNS have been part of. It shows growing understanding for the fundamental importance of caring and of mothers, the primary carers everywhere. So if I've got time, I'm just going to, say quickly what our priorities for improving children's social care are, beginning with recognizing the bond between mother and child as the child's first and most crucial relationship. Supporting mothers is the best way to ensure children's health and well-being. Prioritize implementing financial support under Section 17, as I've said, which must be put on a statutory footing. And implement Care Act support for disabled mothers who have caring responsibilities for a child. Children's poverty must be addressed by addressing mothers' poverty, especially single and/or disabled mothers, and often mothers of colour, who are among the poorest and most likely to be targeted for intervention by children's social care. I would add that mothers, especially young mothers who are themselves care leavers, are often targeted by social workers as well for child removal. And what they get told is, oh, well, you didn't have any experience of mothering, so you can't be a good mother. Yet they've been raised by the corporate parent, which is supposedly better than their mothers were. It's a gravy train, really. Children must not be taken on the basis of neglect, which is conflated with poverty. There's already legislation in California which stops poverty being used as neglect to take children, and a special committee in Philadelphia also proposes that neglect should be removed from the law, and that's what we'd like to see here. There must be an end to the use of predicted, quote, future emotional harm, which enables social workers' prejudices and manipulation to justify taking children from loving mums while they ignore the real present threat posed by violent men. And the idea that newborns are taken, there has been a big increase in newborns being taken, and newborns are very often taken on the basis of predicted future emotional harm when no actual harm has actually happened. There must be an end to forced adoptions. Children must not be taken into care because of domestic violence. Mothers must be supported in their attempts to protect their children and must be helped to escape and live independently from violent men. And at the same time, the presumption of contact must end so that violent fathers are not allowed unsupervised contact or residence of children. And it's crucial to provide the support that families ask for rather than what social workers decide is appropriate, which invariably means intrusive and degrading monitoring and prejudicial judgments. Communities should be strengthened by providing cash and services, not by adding layers of professionals whose priority is intervention and not support. And we've said that privatization of children's services must end. They must not be a profit motive. And finally, give mothers and other primary carers a care income so that the work mothers do caring for children is financially recognized and no mother can be accused of neglect because she's poor. This would protect mothers and children from professionals abusing their powers and acting as if they know best, as if the children belong to the state and not with their families. Foster carers receive between £400 and £600 a week. Why not mothers whose caring work would prevent the institutionalization of children and avoid lifelong trauma? If money was the excuse, supporting mothers would not bankrupt councils in the way profiteering private companies are doing right now. And I'll end there. Thank you.